Hello, I want to thank you all for joining me today. I also want to thank Emily Coles and the group at Two Diabetes for giving me this opportunity. And hopefully everybody has joined to hear a little bit about taking care of diabetes across the holidays, and then also to think a little bit more broadly about getting psychosocial support for taking care of diabetes. So I also want to mention before I get started, I'll introduce myself and tell you a little bit more about what we'll do today. But also wanted to mention that if you check out the Two Diabetes website, you'll see that they're doing a fundraiser now. You should check that out, and if you're able to and interested, make a donation. So what I'm going to do today is I'm going to cover a few different topics. The first will be a little bit of a general idea about maintaining a balance in taking care of your diabetes. And that'll feed into a little bit of a discussion about getting the support that you need for taking care of diabetes. And then I'll move that into the direct application around the holidays. So let me tell you a little bit about myself. So if for those of you who didn't read the bio or don't know why you're here, my name is Korey Hood. I'm a clinical and health psychologist, and my job is really to understand better the intersection between some kind of medical or health condition and kind of the psychological side of it, the emotional and behavioral side. And my work has largely been in diabetes, and I'm currently an associate professor at the University of California, San Francisco, and I also provide direct clinical services to patients and families. A lot of my work the majority of my work is in the kind of pediatric diabetes setting, but do a lot of work with teenagers and young adults. My pathway to here has been spending about a year here at UCSF, and then spent 4.5 years at the Cincinnati Children's Hospital, and then spent 5 years before that in Boston, and did much of my diabetes training at the Joslin Diabetes Center in Boston. So that's what I do professionally. So on a daily basis, I may be writing a grant or working on publication, but also have a lot of activity in the clinic with patients and the team providing care to them. My personal experience with diabetes, I've had type 1 diabetes for 12 years. I was actually diagnosed after starting graduate school. I was working on my PhD, and it was in my second year of the PhD program, and I decided to kind of switch my focus, and one of the areas that was available to me was working in pediatric diabetes and looking at the psychological aspects of it. So I started following families and research and in clinic, and then about 6 months later, I was actually diagnosed with type 1 myself. So for the past 12 years, it's been a major part of my everyday life, both personally and professionally. So with that as kind of the background, so you know a little bit about me and what I do, one of the things that I'd like to start with is kind of this idea of the psychological side of diabetes. And what I'm going to do is, as we're going along, I'm going to keep an eye on some different questions that come up, and I'm going to try and get to them as we go along. I really only have about 15 or 20 minutes of content, and hopefully we'll get through that and I'll be able to answer all the questions. But feel free to throw questions at me as we're going along. So one of the things that I think is really important when we're talking about diabetes and taking care of it and finding this balance, and for me personally, and I think this is shown in the research and clinical world as well, is you've got to find some balance between staying positive and kind of a matter-of-fact approach. And so what do I mean about the staying positive? There have been a number of studies that have shown that taking that intensive management of diabetes and taking care of it, whether it's type 1 or type 2 diabetes, um, results in better short-term and long-term health outcomes. And also many times people are experiencing a better quality of life in those situations. So there are, it's no longer a death sentence per se when you're thinking about diabetes. That's decades and decades ago when people had that idea. It's now, there's a lot of just great positive work that's being done. There have been a couple of reports, one in Diabetes in 2009 and another one in the journal Diabologia in 2010, that highlighted that individuals with type 1 diabetes who go on to not develop any of the kidney problems that often come with it live as long as their peers. And we know that through intensive management, you can avoid those kidney problems. So there's actually a very positive stream of research that's being done now, and with all the new technologies and the advancements, there's a lot of reasons to be positive about taking care of your diabetes and integrating it into your life. There was a recent study that was published on about 450 people in Belgium, and one of the things that they looked at was they looked at these young adults that had developed diabetes earlier in their life, and they were interested in knowing if the individuals with diabetes seemed more mature or engaged in more adult-like behaviors as they got a little bit older. And what they found was that in this large sample, that the patients with diabetes demonstrated more mature and responsible behaviors. And one of the things one of the messages that I take from that is that this is whether it's type 1 or type 2, that there's a complexity and a demanding nature to diabetes management. And one of the byproducts of it, which is a positive thing, is that we often can feel a little bit more in control over different aspects of our life because of it. So that kind of highlights, just for me, and I think that can be helpful when we're taking care of it on a daily basis, that there are some positive things and there are some good things to look forward to, and it doesn't have to be something that you feel negative about. Now, when we think about that positive side in conjunction with more of a matter-of-fact approach, and what I mean by a more matter-of-fact approach is that we have to think about really kind of finding this balance where we're separating some behaviors from emotions. And so we know there's a great deal of research on the contributors to how healthy people will be in their lifetime. And one of the biggest contributors are behavioral patterns, so the things you engage in on a daily basis. And we know that it's much more about the behaviors than some of those emotions. And one of the things I joke with families about is that when someone has when someone has a blood sugar of 300, and what do you need to make that go down? And most people's response is you take some insulin. And I kind of joke with them that what does anger or frustration or sadness, any of those things, what does that do to the blood sugar? And it doesn't do anything. If anything, it might make it go a little bit higher. And so the idea is that whether it's checking a blood sugar or whether it is doing the different aspects of management, that there has to be this kind of matter-of-fact approach that you try and avoid the emotional connection to it. So a blood sugar of 300 doesn't mean you're a bad person. If you missed a bolus, it doesn't mean you're a bad person or you should be frustrated or annoyed. What it means is that it's information for what to do next. And a blood sugar of 300 is a good blood sugar because it's a blood sugar we know. And I think that you can apply that idea, this kind of matter-of-fact approach, to different aspects of your life and in taking care of your diabetes. Because when you attach those emotions to it, it tends to bring down the positive experience that you're having. This kind of leads us into thinking about getting some of the support that you need and finding ways to cope. One of the things that we know from the diabetes literature, as well as a number of other areas, is that people who find positive, adaptive ways to cope with diabetes tend to do better. They do better in their health and those kind of outcomes, but also in terms of quality of life. And so, statements such as, I have diabetes, it's not going to control me, diabetes is hard work, um, but I can take care of it. These are positive, adaptive coping strategies. And we know that when people have this more positive, adaptive manner to it, we know that there are better outcomes. And it's when an issue comes up, it's solving the problem and approaching it in that way instead of feeling like it's the something that you've done is bad or that something external has created this problem for you. So that's one area when you're thinking about getting some support that you need. The other area is when I talk with individuals with diabetes and their families, I like to highlight a couple different pieces that are helpful when you're trying to get support. The first thing that I always talk about is to be a model of the type of support that you'd like to have. So if you're interested in obtaining specific and direct and kind of positive support from people, then that's what you have to do yourself, whether you're talking about a significant other, a family member, a partner. You have to first model what you would like that support to be like. And you can do that by being very specific in your requests. I'm guessing that most of you have the experience of talking to somebody about what's going on in your life, and you don't want them to tell you what you should do or what the next best thing is. You just want them to listen. And I think that we generally do a pretty poor job of being direct and specific with people. When we start a conversation and we just want them to listen, it's okay to tell them that. I would be very specific when you're asking for support or asking for help from people. The other thing that is really helpful in this situation is to yourself be an active listener, because this is what you want the other individuals that you're asking for support from, that's what you want from them. So it's things like when they're talking, making eye contact with them and not talking. It's not being distracted when they're talking, so putting down your phone or not watching TV. It's engaging directly with the person. And then it's also reflecting back about what was said. So if someone is talking to you about an experience that they had, it's okay in the middle of it to stop and say, it sounds like this is what happened, or it sounds like that was hard for you. That reflecting can be a really helpful way of giving support, and then in return you get that same kind of support from the people that you're around. The other thing that I like to talk about when we're thinking about support and all of these different ideas, being specific and direct, and is that you have to talk about these things in a non-crisis situation. So don't wait until some crisis has happened to tell people how you want support from them. It's much better to tell them in a downtime when you're thinking about it, when everybody can have an open mind and no one's defenses are up about what's going on. I think that a couple of other important things around this idea of support is to seek support through various means, whether it's face-to-face, whether it's online. You have to find support in different ways from different individuals and through different resources. And that collection of resources for support is really what's going to make it go a longer way. And the other thing that I like to always encourage people to think about is and this isn't always possible for every individual, but doing something physical can be a really nice way of getting the support that you need. So go with a group on a walk, or go with a group on a hike. Do something physical that because you have multiple benefits from that physical activity as well. So that's kind of just a background to some of the specific things that we'll chat about, and then as I said, if you have questions, if you have different ideas, then please submit those, and I'll address them. The When we're thinking specifically about the holidays, I think it can be a difficult time for people for various reasons. Different schedules, feeling stressed, a lot of different options for eating, which can be one of the biggest ones. And when I think about advice for whether it's parents of kids with diabetes, individuals with diabetes themselves, or support or people around you that are supporting you, that there are a couple things that I like to encourage people to do. And the first one, which I think is the foundation of all the others, is setting some realistic expectations. If you're somebody who who does typically a pretty good job of taking care of your diabetes, it may be worth loosening some of those expectations across the holidays. Now, it doesn't mean that you shouldn't do all of the things that you would normally do. It just means that it might be okay if you have some more out of range blood sugars. It might mean that something is done a little bit later than it was done at normal time. And so essentially it's okay if the results of what you're doing are directly related to stress and different schedules and food and things like that. So I think that it's important to not set yourself up for being frustrated and feeling down and feeling like you've done something wrong. And I think you can do that by setting some realistic expectations that your diabetes outcomes in this time may not be as good as they were in a non-holiday time, and that's okay. I think that the other thing that I always encourage people to do around the holidays is to be prepared for ignorant comments and to have a plan for how you're going to deal with that. My guess is that all of us with diabetes will get some question from somebody is something to the effect of, should you really be eating that? Or I thought you had diabetes, is that okay for you to eat that? And along that line, a lot of people across this time of year, it doesn't mean that it's just an opportunity for some of these things to be brought out a little bit more. But they're unaware of all the aspects of diabetes across the year, but it tends to come out at this time. And so as a general rule, I think you have to decide in those situations, are you going to ignore or are you going to educate? And maybe it's some combination of those. But if you plan to ignore, then that's okay. And but you can't let it frustrate you or annoy you. If you plan to educate, you can give small pieces of information. You can talk about how newer medications and insulins and technologies have actually made it, given us a lot of different options for taking care of diabetes. And while I try and eat a healthy diet, like you, across the holidays, sometimes I eat more than I plan to, or I have more sweets, that having a little bit of education then can be okay. You can also just ignore and move on, and maybe choose a time to send an email or to call the person later on and give them a little bit and educate them at that point. So I think that going into the holidays, not only do you want to have realistic expectations, but you want to have a plan for how you're going to respond to questions that people have or comments that they make, because those are things that tend to stress us out and make us frustrated. I think that the other strategy across the holidays is thinking about being prepared for different situations that are going to come up. And for this, you probably want to have all of your diabetes gear and supplies and everything with you pretty much at all times. You don't have to take it every different place. But this is the time of year when schedules are not what they're normally like. There can be a new activity where a group decides to go and do something. You might have a spontaneous pickup basketball game or football or different activities. And in those times, you want to be prepared because you don't want diabetes to be something that slows you down in any of those situations. And so, probably more than any other time of the year, you want to make sure that you have everything you need with you, some fast-acting carbs, any of the medications you're on, insulin, plans for what might be in the food that you're eating. All of that at your side is going to make you feel a little bit more like you can navigate whatever comes up. So certainly try and be prepared in those situations. And then the final thing I'll note here, which I think applies to the holidays, but it also is I think a general strategy that can be helpful. As we go through each day with diabetes, there can be a lot of stressful parts of it. And because of that, when you get to the end of the day, you need to try and hit the reset button, so that the next day when you wake up, the diabetes from yesterday doesn't affect your diabetes today. And I think it's particularly important around the holidays to try and have that mentality that, you know what, yesterday this went wrong, this wasn't so great, but you know what, I'm going to forget about that, tomorrow's a new day. And as many of you know, as all of you I'm sure know, that across the holidays, each day is very different, and you may be doing a number of different things. And so, for a lot of different reasons, it's very helpful to have that clear, clean start to the day, and don't let that kind of diabetes, whatever's happened the day before, kind of be a hangover for the next day. So those are a lot of the points that I had thought about. What I have some more information, but I wanted to now give you guys a chance to send in some questions. And one of the ones that popped up a little while ago was one that said, is there a network of therapists who specialize in diabetes? And there isn't one that I think is easy necessarily for individuals with diabetes to access. I think that there are a couple of different networks that I'm part of. So the American Diabetes Association is, as you probably all know, does have a behavioral medicine section to it. And so many of those individuals provide both clinical care and do research as well. And so that is a group that you can access. It's a little bit hard to do through the ADA or through other means, but there is what often you might have to do is you have to email somebody who is kind of in that world and can help you kind of find someone locally. There is an organization called the Behavioral Research and Diabetes Group Exchange, where it's about 150, 200 of us across the country, and actually internationally as well, where we get together once a year as a group and talk about some of these different things. But then also we have a lot of different options. We'll have a lot of different local connections with providers. So I think that one easy way to access that would be to email me, and I can try and put you in contact with someone local. It's hard to find that network through insurance companies, and so I think that probably the best way is to reach out to somebody that you know. So just looking to see if there are any more questions. Emily, I haven't had anything show up in a few minutes. Just checking to see if we're still connected there. Um, Sorry for the slight delay. I'm not actually getting any messages, so I'm not sure if there are some more questions. If there are, then I'm not getting them. Um, so if you all will pause for just a second, let me just double check to see if there's some problem here from a technology standpoint. Okay. Sorry about that. I think that we're back up. Um, and let me go through a couple of these questions that I see. One of the questions is, what's the best thing we can say to parents who come to chat who have a newly diagnosed young child or a teen who won't take care of themselves? I think that this is certainly a tricky topic, um, and as many of you know, that I think it's hard to motivate yourself at times. So to try and help motivate other individuals is particularly tough. I think that one of the things that can be helpful in these situations, whether you're a parent, whether you're a provider, is first trying to meet them where they are and understand exactly what it is that they're looking for. Um, I think that we often immediately go to problem solving in many of these situations, and we have to first understand what it is that the issue is, as well as what are some of the things that maybe are barriers to taking care of it. I think when you're specifically talking about a teenager who is struggling to take care of themselves, or a young adult, um, I think it's particularly helpful to find out what are the other priorities in this individual's life that are maybe higher than taking care of diabetes. And when that happens, you can maybe identify ways to integrate that into the rest of their life. The newly diagnosed, I meet with a number of, families that are new to diabetes, and I think that I always try and have some positive um, statements for them, and I have some, there are the things I mentioned earlier. There's some great data out there that being diagnosed now doesn't mean that you're going to have a shorter life. It doesn't have to mean a number of different things. We have great tools and great ways of taking care of diabetes. So, I suggest, being positive and at the same time being, realistic. Maybe putting them very quickly in contact with other individuals with diabetes. I think that can be a really helpful way. One of the things, let me see. Another question that just came up was, can you address diabetes burnout? Those times that we've just had enough. This is, I think in a couple of weeks, maybe in January or February, Dr. Bill Plonsky is going to be doing one of these, and he, kind of wrote what I think is a great book on diabetes burnout and frustration in general. And it's called Diabetes Burnout. It's published by the American Diabetes Association, so you might want to check that out. Burnout is one of the things I think that we all experience in different ways, and burnout can be defined as you're feeling like you're doing the same thing over and over again. This person notes feeling like you've just had enough. You just can't seem to make any headway. It can also mean you're frustrated and annoyed more than usual. The problem with burnout, besides the fact that it just doesn't feel good, is that it often leads to taking poorer care of your diabetes. And when that happens, then we get into this cycle of now things aren't going so well, I'm not taking as good a care of it, I'm frustrated, and it just kind of feeds off this cycle, and kind of it's a negatively reinforcing cycle that we fall into. So when we think about when I work with individuals with diabetes around burnout, we talk about first knowing the warning signs. It's knowing that response to a blood sugar that's out of range or missing a dose or missing a medication. If once that response becomes more exaggerated than it usually is, that's a warning sign that maybe something like diabetes burnout is creeping in. If you find yourself not feeling very motivated about doing something that you were planning to do around diabetes, maybe it was connecting with other people, maybe it was starting the pump, maybe it was doing something different. So I think that there can be, you have to first notice those warning signs. That's a good way to start. Once it does happen, I think that some of the things that we talked about before can be really helpful. You've got to find ways to get support. You can't do this alone. One of the most, I think, immediate needs for someone who's feeling burned out is to find somebody who can take some diabetes management off their plate, whether it's filling prescriptions, um, helping them do some checks here and there, maybe even attending a doctor's visit with you. There's a lot of different ways that as soon as you start reaching out, that you can do that. Now, there were a couple of other notes about depression, and I'll just hit on that really quickly. I think that there is a difference between diabetes burnout and being depressed. And depressed often will mean you're feeling sad and down and lonely a lot of the time. And some of it's diabetes specific and some of it's otherwise. And you're also not as interested in doing things that you used to do. And that in these situations, I think that it's really clear it's really helpful to both identify. And if it's more like depression, you need to more immediately get some help with it. And it may be starting with talk therapy, it may be in different ways. And that's why going back to this network that we were talking about might be a helpful thing. Some of the other questions, one just popped up that asked if I'm on a pump or MDI. So I'll tell you a little bit about that quickly. I use a pump, and soon after I was diagnosed, I was on NPH for about 6 months, which, for those of you who've been on NPH know that it was a pretty miserable experience. And then went to Lantus right after Lantus had just come out, and so I was on multiple daily injections with Humalog for a little while, and then switched to a pump, and so for 10 years I've been on a pump and have really enjoyed it. I also use continuous glucose monitoring, and so I have access to a lot of different information about my diabetes on a daily basis, and there are times when myself I feel like it's too much information, and when that happens I'll take a little bit of a break from the CGM for a day or two, but I wear it pretty much all the time. Some of the other questions, have you seen that social media has made a difference for parents? In what ways? Have you seen that social media has made a difference for people with diabetes, and in what ways? I think this is a great question. I think that the number one thing that social media has done is that it's served as a connection for people and offered them a community. If you're more specific in thinking about social media, different aspects of connecting with people, whether it's Facebook and Two Diabetes and chat rooms in different areas. One of the things that's nice that comes out of that is that it often leads to a link for people to somebody else or something else. And so someone there may connect a family to the Children with Diabetes website that has all of the information about diabetes management plans at school and the 504 details. And so I think the number one thing that it's done is it's been a connection for people that's served as support, but then also as a way of educating them. One of the kind of interesting things about teenagers and young adults I've found in my work is that they're not necessarily going to websites that are diabetes focused. They often will go to a different place. Maybe they'll connect with some of their friends on Facebook or Twitter, or this new thing with Snapchat. There are a number of different ways that they connect, and then maybe diabetes is kind of second to that. Whereas more adults, I think, look for diabetes first, and then they find those connections. And so it's an interesting, certainly an interesting area, but I think that there's a lot of ways that we can probably capitalize on helping families via social media. One of the questions was, what do you do when you lose your support group and your family? Well, I think this is a tough situation. I think that these are the people that you feel like, often are there, always there for you. And so when you lose them, that can be, lose that support, it can be a tough time. I think that, I guess the first place I'd start is to think about making sure that there are people that are providing support to you that are outside of your family. So before anything like that would happen, where they pull back some of their support, you want to make sure that you're connected in other situations. And it can be online, it can be through some of the things that you're doing today. But I think that those face-to-face, trying to find somebody who shares a similar experience, can be really helpful. When it does happen that way in a family, I think that you have to try and go directly at it and talk to if you're interested in getting their support back in a calm, non-confrontational way and a non-crisis time, go and talk to them about it and say, I felt like I've needed a little bit more from you guys, and I've been struggling with this. This has been a hard thing to do. And would you mind helping me with this? You can't go into it with saying that they're not doing a good enough job. You can't blame. But I think that when that does come up, that maybe that's a good way of trying to get some of that support back. How does someone who's an OC diabetic achieve the letting it go for a while? I think that this is a good question. I assume that this term means that pretty obsessive and somewhat compulsive about diabetes and its management, and probably a perfectionistic attitude to it. I don't think that this is easy. It's not easy to let it go, and it's not easy to have a matter-of-fact approach to management. Hopefully everything that I've mentioned is, there's some educational piece to it, but also in the real world, you've got to find ways to apply it for yourself. I think that the letting it go piece is first understanding what all of the information means. So, if you look at the data from the Diabetes Control and Complications Trial, the UK PDS study, if you look at a number of these different projects, or these long-term data, one of the things you notice is that, a difference potentially of an A1C of 7% versus 8% doesn't confer as much risk as I think it's made out to be. Now, I'm not suggesting that you shouldn't try and keep your A1C as close to the range as you'd like, as the target range, but I think that sometimes looking a little bit deeper into the information tells us that it doesn't have to be perfect, that people experience a lot of health benefit from meeting a range, from getting into a target range. It's not about achieving a certain level, and I think that that's one of the things that, especially in pediatrics, we find is kind of a thing that's tough, because I think parents feel that way often, and it can lead to blaming and sometimes shaming from the standpoint of the kids not doing what they need to do. I think it can happen with in adults with providers as well. So I think that one of the ways is to first educate, to get more education, and truly know that that there is a range there, that it doesn't have to be perfect, and we know that. I think that if you're trying to let go in diabetes and you don't let go in other aspects of your life, it's never going to happen with diabetes. And so, working on other parts of your life where you feel like you may be a little bit obsessive compulsive, that maybe starting with those and starting with some smaller areas that you could potentially grow in will actually translate to some letting go a little bit with diabetes. Let's see, on to the next. Kind of related to this topic is, how does a parent with diabetes keep from blaming themselves when their child becomes a diabetic too? Well, this is a tough situation. I think that if you remove the diabetes from the parent's experience when their child is diagnosed, or whether it's the child is 2 or 3 or 4, or like me in my early 20s, and my parents had a very different experience with a kind of a diagnosis. Those parents have to adapt to a new normal, and they have to get over and get past this experience, and kind of this loss of a normal childhood or a normal child in some ways. And so just the simple parts of being a parent of a child with diabetes can lead to feeling guilty about it, can feel like you've done something wrong, and all of the data that we know about, it's not the case that the parents are doing something wrong. It's a lot of it we don't fully understand, between the biology, the genetics, and the environmental factors that lead to diabetes or type 1. We know a little bit more from a kind of a family and biologic perspective with type 2. But so I think when you are a parent who has diabetes yourself and then your child is diagnosed, I think that it can be a doubly tough thing to deal with. One of the things that we know, the data, and I don't have the exact figures memorized, but there's a very small incremental increase for an adult with, say, type 1 diabetes having a child with type 1 compared to the general public, or the general kind of population of people without diabetes. So you're not conferring that much more of a risk. And because we don't know about all of the other factors that are involved in it, there's no way to know if you had something to do with it, and the likelihood is that you didn't. And so I think that first it's worth trying not to blame yourself, because it's likely that you didn't have anything to do with it, other than kind of transferring kind of the same genetic profile that kind of sits in the background for a lot of people, but then is never expressed. So I think that may be a good place to do it, but also some of the other things that we've talked about. It is a manageable disease, and by you taking care of it and modeling it, I think it can be something, a really helpful thing for the kid. And so that may help to actually feel like you're empowered a little bit. One of the things that kind of interesting anecdotes that I tell people sometimes, I have a daughter, and I asked her, and she's, I think that when I asked her this, she was probably 10 or 11 or something like that. And I asked her, what would you do if, or what would you think about it if you got diagnosed with diabetes? I have it and I take care of it. She's like, I think it would be okay. And I said, why would it be okay? She's like, well, because you know what you're doing. You take care of it. I think I'd be okay. And it was a reassuring, a nice statement, but I think that sometimes, it's nice to hear that, because, as a parent with diabetes, and if the child has diabetes themselves, you can sometimes be a good model and be a good, and they feel like you'll protect them. So I think in some ways it can serve as a positive part. Let me scroll down. This is a good question. What are some positive ways to respond to shaming or accusatory comments about having type 2 diabetes? How can one respond without being passive aggressive? I think that, I think that this is a tough thing to do. Um, the assumption in the general public is that anybody who has type 2 diabetes has done something to develop it. And we just know that that's not true. I think that most people don't understand that that's not true. There are a number of individuals simply through family history are at very high likelihood of developing, and when their course throughout their life may have been the healthiest food, engaging in certain physical activity. And so I think that one way to start is to educate those individuals about that. And you can look up data on individuals like the Pima Indians. You can look up data from the Search for Diabetes and Use Study. You can see that it's simply an inaccurate statement that anybody who develops type 2, that they've done something to do it. Now, there are certainly a number of cases where that does happen, where there are things that a person has done in kind of a lifestyle that contribute to it. So I think that first you want to start with the education. I think that the other part of it is they may not fully understand what's involved in taking care of it. They may not understand that you have to take medications at a certain time, or that you have insulin, or you do other injectables, and they may see it as something simply as, oh, you just have to figure out how to eat better. And so it's not only education about why you had it, but education about what you do on a daily basis to take care of it, and also telling them about the positive things that you do to take care of it. I think that unfortunately, I'm not sure that that kind of general ignorance is ever going to go away. But I think that one person by one person, you can make some strides in educating people. And it's hard to, I think that what you might have to do is you might have to, after someone has said something or implied something, you might have to wait till later and call them because you're upset, and your argument is not going to be come across as effectively if you're doing it when you're worked up. And then here's another question. Back to your observation that teens don't necessarily look for diabetes first when connecting on social media. Do you think this is different from how earlier generations developed their self-image, where diabetes was at the center of how people were taught to see themselves? That's a good question, and one I might have to sit on and think about for a little bit. My initial idea is that I kind of joke sometimes with kids who are newly diagnosed and then have it for a little bit longer, and also adults, but we all have to come up with our own diabetes personality, and it can change over time a little bit, but there are going to be some people who wear the diabetes sign out, I have diabetes and this is what I'm doing for it, and there are other people who want to keep it a little bit more private. I think things like social media have made it to where you have less, because there's some pull to different diabetes sites and the different technologies, that there's potentially less room for you to be discreet about it, or especially for kids. And so maybe it has changed a little bit where it's, maybe someone had the chance earlier on where the central part of them was diabetes, and then they had time to kind of think about that and move on from it. Whereas now it's maybe forced a little bit more. So I'm not sure if that exactly gets at your question, but I think that it certainly can be a piece. It can be helpful there. A question popped up about the question, I think this was in response to the one earlier, what if your OCD only relates to your diabetes and nothing else? Then I think that it's the ways that, if it is truly obsessive compulsive disorder, then we know that there are some really good strategies for taking care of OCD and making it manageable and getting rid of it. And those could be things like cognitive behavioral therapy, which is working with a therapist who has skills in helping you understand what happens automatically in your brain when you're thinking. So, you check your blood sugar and you see a number and there's some automatic thought that comes out, I'm a horrible person, I'm whatever. Or in the background, there's this kind of compulsive feeling like I've got to do something about that. That through different strategies there, you can help to kind of get that under control and ultimately get rid of it. There are also a number of the, the kind of evidence-based models for treating OCD, whether it's diabetes specific or kind of more in general. These they also often would include some kind of medication, and so if it's to that point, I think it's probably worth having some kind of evaluation from a psychologist or psychiatrist to see where to go from that. If you want to do something on your own, work on it, more kind of locally and see if you can make some changes. It's never going to change or get better if you try and address it from the big picture. So you may want to break it down into several small pieces and say, this is a particularly troubling part with checking blood sugars. This is particularly troubling with eating. This is a different area. Break it down into smaller pieces and then come up with some plans for addressing just one piece and see if you can make some progress in one area before you move on to the next. It's not, you can't, having the message of just kind of letting go in those situations isn't probably going to help. I think that you probably have to really plan out some behaviors that you're going to engage in to make things a little bit easier to manage. Here's a question. How do you help those who are how do you help those who are dying of a diabetes-related illness and they need to deal with it, plan and tell friends and family, and there are personal planning when they have been diagnosed terminal? So this is there's probably not a more difficult or sad situation than something like this. It's not the same because but you can think about kind of the bookend of diabetes, that the diagnosis, that there's certainly a process where you have to work through. There's a point you have to work toward accepting that this is what's happening, and whether it's a medical diagnosis or being diagnosed as terminally ill, that this is a tough thing to have to handle. And so I don't think that you can do this alone. I don't think that people are able to kind of convince others of acceptance in a very difficult way. I think that as a friend or a partner or a support person, the ways that you can offer your support in these times are to listen, to validate what's happening, to offer to do things that need to be done. And if you're not able to kind of help them get over the hill of this, then it's probably worth trying to have them see somebody that can help them accept it a little bit more. This is an awful thing to have to accept, but trying to do that as a support person, I think is going to be pretty hard. But in the meantime, helping by listening and validating and always being there, I think are the things that you can do, and to help with any of those tasks. So I believe that I have. I'm going to scroll back through real quick. I think we have time for one or two more questions. Um, and the I think the last thing that we'll answer is a question related to this, what we just discussed, and then I'll wrap up with a couple of final comments. What about the perspective of the dying person themselves, not partner or others? Um, you know, I'm not sure that there's, especially in a minute, if I'm going to be able to kind of fully capture everything that goes on here. But I think that if someone is dying because of diabetes or something related to diabetes, um, there's a lot of reasons to feel like this wasn't fair, that this wasn't, you know, I wouldn't be in this situation without diabetes, and all of those things are true. I would think that probably there's it's worth kind of going back and thinking about how accepting of the diagnosis and diabetes, how accepting you were of it at those times when it first happened and at different points in your life, because it may shed some light on how you might deal with it now or other things you still have to deal with. And I think that, the kind of fluffy, soft things of being positive and those things, it's harder to make those work in these situations. And that's why I think that you have to find some good resources to do that and to talk to people and to move on that way. This is no point in your life should you be doing any of these things on your own. So I think I'll leave that at that. I'll leave that there, and then just to kind of just repeat a couple of things as we talked about. I really appreciate all the questions, and hopefully was able to give you some helpful strategies. And again, kind of thinking about rounding out the holidays. There are a lot of different reasons why the holidays can be stressful, and it's not just about diabetes. It's spending time with family, and I think that going into the holidays with a clear plan about how you're going to deal with it can really serve as maybe a model for how you want to approach diabetes on a daily basis. Being prepared and being matter of fact, but also having the realistic expectations that I'm doing what I can and doing a good job today, but there may be some slip-ups, but that's okay. So I think that unless there are other questions, I think maybe, Emily, this is a good breaking point. I want to thank you all for your attention, and if there are any things that you want to connect with me about offline, any of these questions that I didn't fully answer, I'm happy to. You can find my email on the UCSF website. You can shoot me an email, and I'm happy to help a little bit more specifically if I can. So, thank you.